the request for CBT, cognitive behavioral therapy, is people often ask, they ask for that. They ask to have cognitive behavioral therapy, except they usually ask to have CBT because they've been told by a psychiatrist or a doctor or another person in the mental health field or in their medical field that CBT would be best for them.
Okay.
For what, you know, I guess CBT for, mainly for anxiety, but CBT is just immediately recommended. I don't know if it's because it's a well-known type of therapy, but I have noticed that you do use a lot of CBT and cognitive behavioral therapy in your EMDR work.
Mm-hmm. So, yes and no.
That's the answer I expected, actually. Yes.
Because CBT is a process, just like EMDR. And there are phases in CBT that you work through, especially if it's trauma-focused cognitive behavioral therapy. Right? Because in CBT, there's an education component of it. There's understanding and recognizing cognitive dissonance and negative cognitions and behaviors and thoughts and emotions. There's a part of it that's called in vivio exposure in CBT. There's all of these processes for true CBT to happen that are occurring. It's got these, you know, first you do this, and then you do that, and then you do this. And so,
and you're training, and because it hasn't been that many years since you've been out of the university setting, and it's been many years since I was in the university setting. So we did not have training. CBT at the time didn't exist at the time that I was in my graduate work.
okay.
It was a combination of the different behavioral therapies and the different cognitive therapies, like, you know, like Eric Burns' transactional analysis, and with Albert Ellis's rational emotive therapy, and then the behavioral techniques and behavior modification. So all of these were separate theories and treatments and therapies, and we did not have the it wasn't under the umbrella of CBT.
Yeah. Yeah.
In your training, it was CBT, correct?
Correct.
Okay.
So yes, CBT, and then a lot of times what they do is they talk about transactional analysis, or they talk about Robert Ellis's behavioral therapy, but it's and Gestalt therapy. It's very generalized, and what they want you to do is to further hone in to a modality of your choice if you want to go into therapy. But most schools will really focus on CBT. So, like, for instance, like I was saying, if you go into CBT, or specifically trauma-focused CBT, you're going through it's like, because it's so researched, there's a certain process that you need to go through as a therapist working with your client.
But I've noticed during our communicating with each other that you use a lot of the CBT techniques.
Yep. Use psychoeducation, cognitive coping, affect expression and modulation, relaxation. Like that stuff is used in EMDR as well.
Right. Okay.
The difference in it is that EMDR ends up taking another path after you get past cognitive coping. So the thing that's great about CBT, the thing that is very different with CBT is the staple of CBT is the trauma narrative or narrative and processing. Looking through and working through someone's narrative, and when you're doing that, you're looking at the behavior component, the emotional component. Oh man, I'm having a brain fart. The behavior component, the emotion, and the thought. Sorry. You're having all three of those components show up in the narrative. Whereas we're using those three components through eye movement.
Okay, now explain that.
Yeah. So I'm going to use CBT as an example first and how it uses those three components. Okay. So you have an event or you have a story to tell. And as you're telling that story, I, as a therapist, am sitting there and saying, okay, what are some of the emotions that you felt in that moment? What are some of the behaviors you felt in this moment? And what are some of the thoughts that showed up in that moment? Specifically, maybe how did those thoughts turn into beliefs about who you are in that moment? And are any of those any of those thoughts false, but are any of those thoughts distorted? Cognitive dissonance happening. Mm-hmm. Reframing then we start maybe even reframing those thoughts, those beliefs about the self, right? And we construct a new narrative based upon those things that we just worked through. Right?
Okay, yeah, I'm totally with you here.
Okay, EMDR is we spend a very brief moment with a specific event. We don't go through an entire narrative. I just ask, what's the event? What's the image that shows up? What's the emotion? What's the belief about the self? As you look at that image, what belief, negative belief, do you have about yourself now as you look at that image? And then we let the brain do the rest of the work using eye movements, bilateral stimulation, and we let the brain do it. We don't construct anything new. We don't sit down and create a new narrative. The brain will do it all on itself. We just help the client work through anything, any I call it, or stuckness. If there's a moment of being stuck, we help facilitate out of that block from being stuck. And that's it. I'm not gonna, with CBT, you know, we might spend 3 or 4 sessions working through this narrative because because verbal processing is occurring in that moment.
Right.
In EMDR, there's no verbal processing. It's already all there. I'm letting the brain do it. The lower part of the brain do it all.